Hi, you are welcome once again to my channel. I'm very glad to have you here. And in today's video, we are going to look at when can someone with type 2 diabetes be placed on insulin injection. Now, in my previous video, I talked about what type 2 diabetes is. Now, in that video, I said that in type 2 diabetes, the beta cells which produce insulin are not completely exhausted. There are still an amount of beta cells that produces insulin, and the body is not completely lacking insulin. So the treatment that is given is not an insulin injection to replace the lost insulin, but rather these are placed on oral anti-diabetic drugs. Now, there are some people who always benefit from insulin, even though they are type 2 diabetes, and the treatment is not insulin. So, but before that, let's look at this graph here. Now, before someone is diagnosed with type 2 diabetes, at the moment of diagnosis, about 50% of their beta cells are destroyed. And as the years progresses, the function of the beta cells declines by 4% each year, which is a point whereby there's no insulin that is being produced by the body, by the beta cells of the pancreas. So that means that someone who has type 2 diabetes at one point in their life are going to benefit from insulin. Now, I am going to give you in 5 cases whereby someone with type 2 diabetes will be placed on insulin injection. Number 1, if their meal plan doesn't work. Now, in case you know what my previous video on type 2 diabetes, I will suggest that you watch it so that you are abreast with where we are right now. One of the particular treatment of type 2 diabetes is food, nutrition. It's a whole subject on its own. I'll do a video on that separately. And in case those who want to lose weight, but it seems impossible, another treatment of type 2 diabetes is what? Weight loss. But if during this program of losing your weight, but it seems impossible, there's high chance that you are going to be placed on insulin. Now, the oral anti-diabetic drugs which did not achieve their blood sugar levels. Now, anytime you are placed on the anti-diabetic oral drugs, there's a particular level of glucose that we need to observe, which will be detected by the glycated hemoglobin. I'll do a particular video about the glycated hemoglobin on its own, whereby we'll go more into details about what the glycated hemoglobin is and the particular values. I'll do a video specially for that. Now, the regular exercise. There are some people who are, should I say they are lazy? No. But they find it difficult to exercise. Let me be gentle. You know, they don't like exercising. And when that happens, if you don't regularly exercise, it will be very difficult for you to lose your weight. And if you are not able to lose your weight, your glycated hemoglobin will always be high. So, number 5, and the 5 group of people is when always their glycated hemoglobin is always high. In America, for example, anybody whose glycated hemoglobin is higher than 9%, that person is placed on insulin therapy. But we can't just base on only one factor and place someone on insulin therapy. All of these factors have to come into place. And the value for the glycated hemoglobin is not based on just one factor. It depends on the age of the person, the type of diabetes the person is having, the socioeconomic factors of the person. So it's not just a value. They don't just diagnose someone or give a value to someone based on the value of their glycated hemoglobin. Now, what is the glycated hemoglobin? Under normal circumstance, hemoglobin is supposed to carry oxygen. But when there is so much glucose in your body, they get attached to your hemoglobin A. Now, when they get attached to the hemoglobin A, it is very stable for a very long period of time during the period of life of the the hemoglobin. That is for 3 months. So anytime you go to the laboratory, the doctor will say that, oh, let's measure the glycated hemoglobin. What is the importance of that? That value helps us to determine how are you able to equilibrate the amount of glucose in your blood for the last 2 and 3 months. And it is very important for us to know that have you been able to really manage your diabetes. If that is really done, you have a particular value. You know, this is an interesting topic. As I'm talking about it, I'm very excited myself. You know, I'll really do a video on the glycated hemoglobin, and we'll go more into details and see the interesting facts about the glycated hemoglobin. All right. And then that is what I have for you today. The concluding thought for this particular video is being placed on insulin doesn't mean that you are a failure. Being placed on insulin doesn't mean that you are a failure. It is also one of the ways of treating diabetes, especially type 1 diabetes. Now, because of the various disadvantages of injecting oneself and the weight gain that is associated with the insulin injection, that's the reason why a lot of people don't like it. But I just want to clear this idea that, or this notion that anytime you are placed on insulin, it means what? You are a failure with your diabetes. No. And one thing I realized during my practice so far is depression is one of the reasons why a lot of the type 2 diabetes patients, or even diabetic patients in general, that's the reason why they find it difficult managing their diabetes. A lot of them are depressed. And for you to really manage this, it is a work on its own. You need to be very motivated, like to be able to motivate yourself to even follow the food plan. You need motivation to even inject yourself every day. So that means you need a group of good people who will be there for you psychologically to motivate you to carry on this treatment. Diabetes is it doesn't mean that it's a death sentence, especially if it is managed properly. I hope that video was helpful to you. Kindly subscribe and get access to similar videos. Like, ask your questions in the comment section, and share with your loved ones so that they can also benefit as well. Thank you for watching.